celebrities.
It's like when you're gay, you've got a gaydar.
Yeah.
We've got a transar.
Transar. A doldar.
A
doldar.
Oh,
A doldar.
I like that. It sounds like you'd saying dildo in an Australian accent.
A doldar. Or no, my
A doldar. The kettle's on.
Gail, hurry up. We're on live.
Oh shit, sorry.
Come on. Oh, Gail, right. Come on. Let's do this.
Come on, right. Hi, everyone. I'm JC.
And I'm L.
And this is where the tea is mutual.
Round of applause. Oh, yeah. I'm in my Hannah Montana phase at the minute.
Have you watched it yet?
No, not yet. No. But all I keep hearing is, oh.
Yeah.
That's do you remember?
My line.
That's my line. But do you ever remember the, when it would change, scene and it would, show the house and go, whoa. Yeah. That stim has been in my mind
I
constantly.
think it's been in my mind since it was a meme.
Yeah, since 2006.
Mm.
Whoa.
Yeah.
You get the limo out front.
Hello.
Hottest styles, every shoe, every color.
Wow.
When you're famous, it can be kind of fun.
Yeah.
It's really a trendy, but no one will ever discover
the same parts.
The same parts.
Oh, girl. It's not meningitis, I promise.
It's not meningitis. It's just detransition-itis.
Detransition.
Who? Not me. Not you, girl. But can we just say, obviously, as you can see, you are not seeing our beautiful faces at the moment. We are still having...
They took my fucking eyes.
My eyes. They have took our cameras.
Yeah.
We've had technical issues with these cameras the past few weeks, and it's still ongoing. We are fighting.
They're saying until you retouch that film footage, you ain't getting them back.
Exactly.
We see your 5 o'clock shadow from 2 doors away, girl.
Mm-hmm. Hence why we went and get more laser.
Yes.
We are insecure bitches.
Yeah. I think that's a good segue into our topic.
It is a really good segue into our topic, which obviously we have also mentioned into the intro of this.
Yes.
Is all about detransitioning.
Who?
Not me, and definitely not you, girl.
No, girl.
Obviously, this is not a new topic. It has been happening as long as trans people have been around. But I do find, as of recent, it's becoming more of a common thing.
Yeah, and, it's a bit shocking, in all honesty.
I think it's shocking to us because we could never. To us, this was the one and only path.
Yeah, if it wasn't this, I'd be 6 foot under.
Literally, and I best be 6 foot under, because if you burn my corpse, I will come back and haunt you, and you will never have a sex life again.
Yeah, work.
Because no, thank you.
No.
But I think it is bizarre to me, because it's something I would never expect myself to do. And I do think, because we touched basis on this in a couple of episodes ago about how trends come in. Obviously, we had the gay trend, the bi trend, the non-binary trend, the whatever else, and the trans trend. I think a lot of these detransitioners were following the trends. And I'm not saying that in a bad way, I want attention, I'm going to be trans because it's cool. I mean, maybe because it's blew up in popularity and on the media, that they're like, maybe I am this, and haven't fully took the time to look into the mirror themselves.
Gail, it's like, every year that Pantene, is it Pantene or Pantene colour comes out, and it's like the colour of the year.
Yeah.
I guess in a sense,
Pantone.
it's like Pantone. Yeah, Pantone. I guess it's like that in a sense, let's just say burgundy is this year's colour.
Everyone will run away burgundy.
Everyone will get it. But then, you're sitting in your living room 6 months after, and you're like,
why
this is driving me absolutely crackers.
Literally. It was like the crushed velvet phase where everything was crushed velvet.
Like mirrors.
My mother. I love you, class. I don't think you listen to the podcast, but at one point, that girl, I remember one time the whole house was leopard print. We had leopard
But
print.
leopard print's
No,
cunty.
not like this. We had purple.
Like Cat's Later.
Yeah. If she threw up and was plastered, skinned alive and plastered on my walls. We had purple and black leopard print wallpaper that was like foiled purple in the living room.
Oh.
My mum had brown cheetah print in the living room. And then after that was the glitter phase. Do you remember the glitter encrusted wallpaper?
Girl, you'd find it everywhere.
Every wall in the house had it in it. And then it was crushed velvet.
At least you could exfoliate your face on the wall.
Girl, you wouldn't have a face left.
Yeah, it's like some people.
Literally, it's glass.
Yeah.
But I do find a lot of detransitioning recently, especially within our community. I think there's been about 3 or 4 since
Yes,
December.
ma'am.
Which
And one pending.
we won't name who, but I think when I saw this, I did think maybe this is a topic because it is something, it is happening. I know there was an interview not long ago on the BBC.
I was just about to say, and given the current media that's out there,
yeah,
I think it's a good time to to dive
because
into
was it the day after or a couple of days later, the trans woman who transitioned at the same time as her come in, and she was like, she's the minority, I am the what was the quote?
Majority.
I am the majority.
I think something
or
like that.
something along those lines. But it's true, but obviously for you guys who don't know what detransitioning is, it is obviously someone who stops identifying as transgender or reverses some aspects of social, medical or legal transition.
Yeah.
Which is basically meaning, socially is when they come out and say, I am trans, but I haven't done the medical, which the medical is like hormone replacement therapy.
Surgery,
even therapy as itself. And obviously legal is changing your name and your documentations. And obviously, like I've just said, that is literally everything, pursuing medical reversals, hormone therapy, and changing their pronouns and names back. Couldn't think of anything worse.
Yeah, don't get me wrong. My cousin Ellie, we've always kind of been like Tweedledee, Tweedledum, super glued to each other's hip. Sometimes we talk about and go, imagine if I just decided to go back. And she's like, no. She's like, I can't see that for you. She's like, if you did, it would look so wrong.
Yeah, I think
I
think at the time, it's because when you are trans, and I don't mean like, and I put air quotes, you would see this if the camera was
if
here.
they didn't take our fucking eyes.
If they don't take my lens, you'd know I'm doing air quotes. Trans people.
You can hear the bones clicking.
Literally. Obviously trans people, when real trans people come out, everyone goes, this looks right, this looks like how you were always were. Like I have family that sits there with me and go, I forget that you were born a man. Like it's insane.
Do you know my opinion? I think it genuinely, and correct me if I'm wrong, I think it's all within the eyes.
Yeah, I think when you're true to yourself within your aura, it expresses, do you know what I mean? And because I can't even say, like, people have been saying this to me as long as before hormones, because I socially transitioned before hormones, as most people do before hormones. I've only been on hormones just over a year. I've been socially out for 4 years. And people I've known, like, I've got friends who I've had for most of my life, and they're like, I forget that you were not always like this.
Yeah, my family even say the same. Me auntie and uncle, half the time they forget, and we're talking about whatever, and it's more than anything like the whole talking thing. Yeah. So my preference is skirts and dresses all the way.
Which we spoke about quite a few times on our preferences.
It's just more comfortable for me, because I really do not enjoy the talking aspect. I will if I have to. The art of talking, it's not for me. If I have to, I will.
Oh, don't get me wrong, it is painful. I am someone, like, I'm the opposite to you. I am tucked even when, like, I'm wearing a pair of baggy jeans right now. I could probably walk around not tucked. But for me,
it's your preference.
It's my preference. As much as it is painful, I get blisters and cuts and pinches and scrapes. I can't not do it.
I went through all my teen years doing that, and now that I'm grown, a bit more grown.
Yeah, into the mature lady that you are now.
It's just not a pleasurable experience.
No, it's not pleasurable in the slightest.
I don't see why I should sit around in pain when I get the surgery. I'm going to be in pain for a good number of weeks,
months.
And I don't want to be constantly in pain, if that makes sense.
I completely get that.
but I'm digressing a little bit. But me, you know, my auntie and uncle, if it's been a job interview or an appointment of some sort, they, you know, get you some nice pants, and I'm like, you know, Marg, I'm like,
I'm not into pants.
I'm just not into pants. And they're like, why? And I'm like, because, you know, I have to talk. And like, oh God, oh Babby, you know, we didn't even think.
Yeah.
You know,
and do you know what? That is so lovely to hear. And that's why I think it does shock me that, you know, because I know from what I've heard through the grapevines over the past couple of months while these detransitioners have grown in numbers.
They're spreading.
They're spreading like a virus. Coronavirus, detransition virus, coming to you in a bottle.
Anti-trannitis.
Literally, yes, Queen, anti-trannitis. I like it.
That's a drag queen name.
It really is. Coming soon, coming this fall.
Anti-trannitis.
Love it. If that's not your next drag name, I don't know whose it is, but someone take it, please.
Copyrighted.
Cha-ching. But I have heard through the grapevine, obviously some people say it's not worth it. And if that's the waiting lists, if that's this or whatnot, how can you say that? Because I think personally it diminishes the experience of being a trans person in general.
Yeah.
I think, how could you say that when people have fought through the tooth and the nail to get where we are now, and our trans brothers and sisters that came before us had to fight even harder to get where we are now, and for them to just go, it's not worth it.
Don't get me wrong, I know there's certain aspects of a person's, just of a person, you know, mental health or, you know, struggling to translate certain things into a conversation. I understand that aspect of it, but at the same time, if that is who you are, you will break all those barriers.
Of course.
You know, like we've had conversations before we're audio recording this episode. We've had a few conversations about it ourselves, and I wouldn't say it got quite heated, but we were speaking passionately.
Yeah, very
about
passionately. I think with us, because we can have, like, even though we're on the same page, most of the time we do have our differences.
Yeah, but that's just fucking late at the end of the day.
That is, Jeremy, and I think because we do stand in different parts and places, because for me, I'm very like, no.
Yeah.
If you say it's not worth it, then clearly, one, you were never trans.
Yeah, I agree.
And how dare you diminish the experience of a trans person by saying such a thing like that?
Like, I completely and wholeheartedly agree. But then I do believe there should be a little bit of leeway. Not a lot, because, like I'm saying, I do understand, you know, if you're saying it's not worth it, you know, baby, come on, wake up, it's real life. Everything's a fucking struggle.
Exactly. You got to fight for everything nowadays.
You know, but there are extenuating circumstances, that,
pop the cock.
That's what it's like when you talk, pop the cock.
Free the balls.
Free the balls.
Snippy snip.
No, can't.
There's situations and stuff.
You know, where I do believe, okay, you know what, credit where credit's due. Let them just figure it out themselves, you know, because
at the same time, though, this is the bit I think is damaging, because it's people will take these and run with it and go, say it's just a phase, it's not real.
Yeah.
Whereas if you were really going to consider being a trans person, not even consider, because you know if you are or you're not, but if you are a trans person, before you socially come out, you have these conversations with yourself.
Yeah, true.
You know, you do the research.
Yeah.
Do you mean, I know before I even went to my first doctor's appointment to ask to be referred, I looked at how long the waiting lists were. I looked at the procedures, see what needed to be done, what I could do, how long I had to wait and be socially out to transition my name into my new name. Are you telling me you can't do that? Because if you can't do that, then you're just acting irresponsibly.
And like Google's there, babe.
Literally, ChatGPT's there.
And I'm not being funny. If you are within a community, you know, unfortunately, when I first came out, I wasn't within a community. So,
no, same.
But I had Google.
Yeah.
You know, I could put two and two together and be like, you know.
Yeah, it's not difficult.
But if you are within a community,
which obviously Liverpool is very blessed to have that at the
Yes.
moment. I know there's more than just one transsocial. There's multiple now, from what I've seen.
If you're within a community and you're complaining that it's not worth it, I can't do it, I'm
maybe
struggling.
it's not the right path for you.
Yes, but you've literally got a community there.
Literally, that can help
of
you.
people that feel, if not the same, similar.
Yeah, because obviously, is the waiting lists great? No. No one will say, yeah, it's
Bitch,
the best thing ever.
If it was great, do you really think we'd all be struggling this
Exactly.
much?
Like, we all have bad mental health because of waiting lists, because of things that we can't control. But, guys, like, wake up and smell the roses.
Quite
like
literally.
I've said
wake
once,
up and smell the cracked coffee.
Literally, like I've said once before, it's okay just to be a boy.
Yeah.
It's okay to be a cross-dresser.
All right, Nikki.
All right. Boys will be boys.
Like, okay, calm down.
But it is true.
Yeah, to a certain degree.
To a certain degree, obviously, I'm
She
not...
meant it derogatory.
Yes, I'm not meaning it in a derogatory
No.
term.
You'll know it if she does.
Yeah, you'd know about it. But I mean... It's okay just to be a cross-dresser.
Yeah.
It's okay to like
It's
wearing a
okay
wig.
to express your gender identity in whatever way you feel is needed.
Yeah, but
if you want to wear a skirt one day, wear a skirt.
Exactly. No one will bat an eyelash.
Wanna
No
wear
one will
pants,
give
wear
two
pants.
fucking flying
Yeah.
shits.
Or if you want to present as a female,
But be masculine.
but
be a man.
but
That's fine.
not have medical transitions or etc. Fair
To each
enough.
their own.
Okay, that's each to your own.
But I think when you come out and say, yeah, I am a trans person, I am this, I am that, and then
it puts the spotlight on
all
the
of
collective
us
immediately.
Exactly. And there's some of us that have had to fight hard and long battles to be accepted in the places that we are accepted in now.
And don't get me wrong, I know it's prime example. I'm not sure if you did, but when I first came out, I didn't just go straight to trans.
No.
I was like, oh yeah, I'm bi.
Yeah.
And then I was like, oh yeah. Oh, then after a little bit, I was like, yeah, I'm not bi.
Yeah.
Then I was like, oh, I must be gay then.
Yeah.
And then I was like, yeah, something's not feeling right. And
Like
then
something's right, but not completely right. Like it's
Yeah.
not all the way there. Maybe it's
then I
something
did a bit
else.
of research, came across a few YouTube channels, and everything clicked into place. And I was like, oh, so it's okay to make a mistake, but it's then when you start backtracking and you're like, oh no, well, I felt like I was not forced into being trans,
but
I
pressured
into being trans. Come on.
You made the decision to start.
Quite literally.
Like,
You know,
grow
fair
up.
enough if it was a child. You know, I know
But how
children are...
rare is it now that children get to socially transition? Look, right,
Mm-hmm.
look at your case.
Go on.
Do you know what I mean? You have been on a waiting list since before puberty, and you were forced to go through adult puberty because they couldn't get to you in time.
7 years.
Do you know what I mean? Like that could have been avoided if kids were getting transitioned that quickly. Everyone would be doing it.
Yeah. You know
Everyone would, not everyone, but all
lot
the
of
trans people would be doing it.
You know, I've known quite a few, not in person, but I suppose over the internet. I know a few trans people who have had the privilege to transition at an early age.
And it is a privilege.
You know, like that lady that was on This Morning.
Yeah.
You know, she had the privilege to transition at an earlier age, you know.
Yeah, and it did her the world of good. Have you seen that girl?
Gorgeous.
Couldn't tell.
I know.
And I can clock anyone. Do you know what I mean? And before anyone comes at me, I think trans people can always clock a fellow trans person.
Yeah,
because
it's like
we can
when
look
you're
at
gay.
our insecurities.
It's like when you're gay, you've got a gaydar.
Yeah.
We've got a trans.
We've got a transar.
Transar.
A doldar.
Adult.
A doldar. A doldar.
I like that. It sounds like you'd say dildo in an Australian accent.
A doldar. Or no, my
A
doldar.
doldar.
But it's true. Like, I know, like, me, I don't like my hands. I can see my broader shoulders. I can see, like, my face shapes. And I'm like, I can be across the room and go, oh, there's a doll over there. And everyone's like, where? And I'm like, over there.
I am the same. Well, you're better at it than me.
I am, like, I can clock
Elle's got,
anything.
like, eyes like a hawk.
I have.
Well, kinda.
Well, I haven't got 20/20 vision, but I do have.
You got 119 vision.
Yeah.
One eye open when you're sleeping.
Call me Left Eye Lopez.
Yeah. I think that's a good segue into talking about how common is detransitioning.
Not very.
Not very, surprisingly,
To
considering...
be fair, but we've also got to remember is trans people as a whole is what, 2% of the population? Something, it's either 1 or 2% of the entire population is trans.
I don't know the statistics.
It's a very low number. I think it is 2%. So out of that 2%, then they are even smaller.
Yeah, it's because it does say research consistently shows that detransition is relatively rare. Studies suggest rates are generally low, often under 5%. But obviously it depends on how it's defined.
Yeah.
And apparently many people who do detransition do so temporarily.
Yeah,
not
because
permanently.
I know of some trans people who later in life say they're in the 30s. In the 30s. And, you know, they want to have kids. And a lot of people think once you start hormones and testosterone blockers that's it. Like, you can't reverse that. You can reverse it.
Oh, really?
Yeah, you can stop your Gigi Gorgeous. Stop
sugar,
taking
yeah.
her estrogen and testosterone blockers for a little bit so she was able to produce more sperm to try and have a child.
Oh.
It didn't work, but in some cases it can.
Yeah.
So a lot of people's detransitioning away.
I could never do that.
I could never do that.
Because I was told when I went for gamete storage, I've never been able to produce live.
You lucky girl.
sperm.
You lucky girl.
I could produce
everything else.
Yes, I
Not
couldn't
live.
produce. Yeah,
Lucky girl.
dead.
But to be fair, I've never had mine tested. I've always said I'd love to be infertile, and I don't mean that in any bad way.
Yeah. Just
But
not for you.
it's just not for me. I don't want kids. But I have always, like, my mum asked me, she was like, please, will you freeze sperm, you know, before you start to medically transition? I went, well, no.
Yeah.
I've never wanted kids, so why would I pay for
Yeah,
it?
why would I start now?
Exactly. Like, why would I start paying
Well, you
now
wouldn't
for
have
that?
to pay for it. You can get it through gender clinic.
I'd be asked. Could you be asked fighting for them? But, you know, here's a few, like, common factors on why people detransition. Obviously, I don't know them all, but I can list a few. Social pressures or stigma, which is like family rejection, discrimination or safety concerns. Some people detransition because their identities change because of the external pressures. Changes in identity. So some people later feel that their gender is gender identity is different than they initially thought. Medical or practical reasons like cost or access to care, health concerns or side effects. Obviously, there's a lot of side effects with HRT.
But I'm not being funny. There's a lot of side effects for every medication.
Of course, do you know what I mean? You've just got to take them when you take them. At the end of the day, you love to say about cancer. If I'm going to get cancer one way or the other, in about 20 years, it'll come out saying that the street lamps on the road cause cancer.
Yeah. It was like that burn toast saga.
Like it causes cancer if you eat it.
Yeah.
Hon, I don't have to tell you this. Or your phone in your bra causing breast cancer. I'm like, babe, there's more gamma rays going through your bloody microwave and you heat your food up with that in microplastics. I want you giving yourself cancer anyway.
Yep. And we've all got the cancer gene anyway.
Exactly.
It's just activated in some people
Mutates.
and not.
I don't care.
Oh.
You know what I mean? I'll smoke a bit of cannabis.
Oh.
Because I won't do chemo.
Yeah.
Are you messing? Girl, I've paid far too much money for this hair.
No, quite literally, girl.
If
I will be dying with half a head of hair.
Do you mean I may fry my hair off with bleach?
Yeah, but that's my choice.
That's my choice.
Yeah.
I will buy extensions. What am I clipping extensions to when I've got no hair?
I mean, you could just get a really good wig.
Girl, that is still itchy. I have paid like $1,000 for a human hair wig before today. And
Could you just rock
itchy.
like a cunty turban?
Ew.
No.
No offence, but ew.
Oh.
I haven't got the face shit for it.
True.
Would not do
Neither have I
anything.
actually.
Obviously, other reasons are medical health factors like co-occurring issues like anxiety, depression, or trauma can be contemplate identity exploration, and this is studied within the mental health. You know, like there are valid points.
Yeah.
Do you know what I mean? There is concerns. Obviously, they haven't put fertility on here. These notes that I wrote up about 2 days ago, so I didn't put them in. But I digress.
Yeah. She's adding it in now.
But it is also very crucial to understand detransitions are the minority within the broader transgender population.
They are the minority within the minority.
Do you mean they are the minority within the minority, and we are
the minority?
Not even the minority, but we are the standard.
Yeah, we are.
Do you know what I mean? And because people do transition doesn't give anyone the right to lower the trans experience because of it.
Yeah, just because one person decided it wasn't for them doesn't mean you should go and penalise everyone else.
Exactly, and that leads on to this point, which is their expectations are real and are valid.
Yeah, of course.
But they do not represent most trans people.
Say it louder for people in the back.
Does not represent most trans people.
Exactly.
The minority of transgender individuals report improved well-being after transition.
Don't get me wrong, my mental health still shot down to a T, but that's from external factors.
Yeah.
I, as a person, I, as an individual, regardless of trauma I have experienced, feel so much better.
Yeah.
Living openly, freely, and authentically
Yeah.
myself. You know, I would be dead now
if it weren't for
my
being able to
transition.
access what you needed to.
In all honesty,
I completely get it. We have touched bases on this a few times.
Too many times.
Too many times.
No, never enough.
Never enough.
Never enough. Never enough.
For me.
For me.
For me.
Pavarotti up in here. Anyway.
I feel so stuck me on a loop.
I am brave. I am bruised. This is who I'm meant to be.
She is tranny.
Oh, girl.
Anyhow, obviously people do regret certain things, and it is very common during, it's not just within the trans community that experience regret during. These people who go and get surgeries all the time and regret it down the road.
You regret your fox eye facelift?
Literally, I know people who have had like nose jobs, and like 10 years later when the nose jobs aged, you went, why did I do that?
Yeah, it's like the girl from Dirty Dancing.
Yeah, like it ended her career because she didn't look
her.
the same. But detransition over regret. Some people detransition due to external circumstances but still identify as trans. Regret rates after medical transition are very low in most studies. So
I think, you know what, sorry, I know I keep going on a bit of a segue here, but it's crazy the amount of proof the media have got on happy, comfortable and lived in trans experiences, yet they still decide to focus
on the negative,
on the minority.
They do it, I think, so then they have a weapon.
Yeah, to weaponize
because
it.
a lot of people, no one cares about happy stories. When was the last time you heard something happy on the news?
Back in 1982.
Even then, they were like, war, nuclear bombs. You know what I mean? They do not care about happiness. They want to scare people. They want to put fear-mongering into people. And to be honest, most trans people that are happy and living are just too busy living their own life.
Yeah, true.
It's not until that our choices and our rights get brought in to the conversation that they go, oh, wait a minute, why is this getting conversationalized now?
Of course. Yeah. It's so stupid, man.
It is. It's pathetic. It really is. And obviously, challenges faced by detransitioners, obviously they are going to get stigma, social stigma from both cisgendered and transgender communities.
So do we.
Yeah, exactly. And lack of tailored medical or psychological support.
So do we.
Literally, and feelings of isolation or confusion. At the end of the day, darlings, that's the exact same thing that all of us go through. You just, if
Don't
you
get me wrong, I can imagine how it might be heightened.
Yeah, I think it'll feel quite lonely because obviously, I don't like to say the term cisgendered because I just don't believe it. I think the difference is male and male and trans man and female and trans woman. That is the difference to me. I just don't like the term cis.
I agree to a certain degree. At the end of the day, we're all women, we're all men.
No, of course.
You know, I understand in certain pathways there has to be the differential. You know, whereas women, trans women, men, trans men. I get that. But across the board, I just don't see what the problem is. Why can't we all be women and all be men?
Yeah, of course, which I completely understand, but I do not like, and I have always stood with the men and the women that were like, well, why is cis now getting pushed onto us? First off, trans people didn't invent the term. It was a term pre-made by cisgendered people.
Yep.
And it's just been weaponized to make it sound like the trans people pushed it on. I don't like it. I don't agree with it. Like we have both said, our idols are women because it's women who taught us. They are the blueprint. Yeah. They are the highest species. You know, without them, we are not here. Do you mean without women, there's no life?
Okay, so I think we should talk about how the topic is used in public debate. And we've just lightly briefed on it in terms of weaponization of detransitioning and being trans. I guess detransitioning is sometimes highlighted in political or cultural debates.
Yeah.
And it is worth being cautious because some narratives do overemphasize detransition rates.
Yeah, they
to make it
seem like it's a bigger problem than what it actually is.
And others may dismiss detransitioners' experiences, which I don't agree with. But at the same time, people dismiss our trans experiences at the same time, so it's kind of expected.
Yeah, I think across the board, people are always dismissed. I mean, women have been dismissed for centuries.
If you do not fit into the binary, and this is regardless of sex, gender, race, blah, 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 whatever it may be, if you do not fit into the, you know, the social normalities, then, you know, expect for your experiences to be dismissed.
Yeah, of course. Hands down, Bible.
Yeah, Bible.
Work. I need a salad.
A salad. Right in front of my salad.
Oh my God, how could you?
But I think it is good to note that a balanced view does recognise both.
Yeah, it does.
You know, and it's the importance of supporting transgender people.
Yeah.
And I think also it's the need to support detransitioners compassionately. I think we all need compassion and
compassion makes the world go round. If you had a little bit more compassion in this world, the world would be a lot of a better place. And I think we have touched bases on this about how people have lost a lot of compassion over the years and like knowing their P's and Q's. But I think if like it hits it right on the head, you know what I mean? Like I think compassion makes the world go round. Obviously, in this podcast show, we do have like our own like personalities here. Obviously, JC's very much the angel, very pink, very nice and sweet and polite, and I'm a bit of like the firecracker. Yeah, I'm very like outspoken. Like no,
outspoken. I was like, who's Albert Spoken?
Albert Spoken, your daddy. But that Jane, and obviously, do I believe everything I say? Yeah. I stand by everything I say. Am I always going to say what I say is right? No. Educate me. But I am very strong. What? What did she say?
Nothing. We don't have the headsets on. She can't hear me half the time.
But I will stand by what I say. Obviously, if I offend anyone, that's not my problem. If you are offended, that's your problem. Yeah. I'm not coming at you personally. I'm not saying anything derogatory between you. I'm just expressing my feelings on it. As a trans woman, that could never see this as being an option for me.
Yeah, of course. And I think it's good to notice that because not everyone's going to be on the same side constantly. No. You know, people will get hurt regardless. Yeah. You know, that's just the way the cookie crumbles.
Don't get me wrong. If someone comes to me and I'm deciding to detransition, I wouldn't look at them any other way.
No, of course
I would not be a cunt or be nasty. Choice. It's their choice. To me, it is absolutely goop smacking. Do you know what I mean? Like, how? Why? I'm more puzzled.
Just because we could never, like we've said.
Exactly.
You know, that's the only reason we'd be taken aback.
Yeah, but like, what do you mean? Like,
why would you do that to yourself?
Literally, like, oh my God.
Yeah, but at the same time, we'd still have, you know, compassion for them.
Of course, I'd sit there and talk to them and go, okay, why do you feel like that? Do you know what I mean? And, like,
we'd have a debate.
We'll have not even a debate, but we'll have a conversation.
A
conversation about it.
Yeah. I just love a good debate.
Well, I want to know debate. More. Do you know what I mean? Like, tell me. Like, I don't get you.
Yeah, please.
No.
I'm too blonde for this.
I'm a tranny. What have I told you about my matching?
Oh my God, shut up. Okay, so I think it's good to know that the bottom line of the
she is a bottom, by the way. Ching.
L's a top. A mask top. I'm joking.
The audacity.
I'm joking. She's a
femverse.
Femverse.
She's a very
wicked. So the bottom line is detransition exists, but it's uncommon and varied.
Barely. Barely. Anyways,
Reasons are often complex and not purely about mistakes. You know, there's many things that go into it.
Yeah.
Both
Like
trans people... William.
The lore.
The lore. Both transgender people and detransitioners benefit from respectful, evidence-based care and support. The media pits everyone against each other.
It does. Okay, so large studies and population data. 2015 US transgender surveys 27,715 people.
English.
Does that mean less than? Yeah? Or just 8%?
Less than 8%.
Less than 8% reported ever detransitioning temporarily or permanently. Most were temporarily, not permanent. 2022 US trans survey of less than 92,000 people. Less than 9% reported detransition at some point. Only 0.36 detransition due to regret. Very small minority. UK gender clinic study N equals 303.
Wait, what are you reading?
Dad, N equals 303. I don't know if that's the name of the study.
Number 303.
Oh, number 303. N equals 303. 0.33% current detransition rate, less than 1% including prior history. Spanish clinic 2008 to 2018, number 796, is 8 cases of detransition/regret. And bear in mind, that's in 10 years of less than 1%. US military healthcare cohort, less than 70% continued hormones after 4 years. Discontinuation doesn't always equal detransition or regret. And then we also have systemic reviews, strongest evidence. 2025 systemic review, multiple studies of less than 7,000 participants. 0.8% to 7.4% changed their mind before treatment, and 1% to 7.6% discontinued puberty blockers or hormones. Another 2025 review, regret after transition. Is that greater than 1%?
Greater than,
yeah, greater than 1% overall. And then the impending numbers. Detransition can mean many things: temporary pause or permanently reversal. Temporary detransition is much more common than permanent, and regret is constantly low across both studies.
Let me just jump in really quick. So, I was saying, bear with.
And there's more statistics to come your way, darlings.
You know, about discontinued puberty blockers or hormones. As of right now, I have stopped taking my testosterone blocker. That does not mean I'm detransitioning.
No, it's good to have a break from it once now and then.
I've just temporarily stopped because of hormone issues, but I was noticing I was getting really depressed.
Yeah.
So I might have to figure out a new tea situation.
And there's other forms of tea blockers. There isn't just that one.
I'm
specific.
still on a tea blocker.
Yeah.
To a certain
Well,
degree.
you're on the same one I take.
It's just not as strong as the injection that I usually receive.
We've all been there. It doesn't mean
but
anything.
I'm pending an appointment.
I stopped taking my testosterone blocker for 7-8 months.
Yeah.
And that's because my doctor said, you're basically, undetectable. You should be fine. And I asked, well, what if I feel like there's a spike? They went, well, then you can go back on it.
Yeah.
And for 7 months, didn't touch it.
Yeah.
Still took my hormones, but didn't have to take a testosterone blocker until last month. I started taking it again because I felt like it was spiking.
Yeah.
So it doesn't always mean, because you've stopped something for a little bit, meaning that you detransition. You could be doing it for health, you could be doing it for mental health, you could be doing it just to take a break and see how it goes and see how regularly you need it without having to get it on a regular basis all the time.
Completely.
And it obviously will lower the risk of any side effects.
Yeah.
Right, there's only a few more that I will give. Personal experiences and testimonies, common themes in research interviews. A study of 100 detransitioners found 60% that said that their understanding of gender changed over time. Many cited mental health struggles, dissatisfaction with physical results, concern about medical complications, and trauma or external influences. Social pressure plays a major role across multiple data sets. Top reasons include family pressure of 36%, discrimination/harassment of less than 30%, and employment difficulties, which we all know as a trans person is very hard, but not impossible.
No.
This means many people detransition but not because they aren't trans, but because it feels unsafe. Life becomes too difficult socially or emotionally or economically. Insights from community discussions, Reddit example from a trans community discussions: when discontinuation happens, it usually due to external pressures, stigma, family rejection, financial barriers. Another user summarized only a small fraction of detransitioners permanently detransition. Most return to transitioning later.
Yeah.
And then your psychological impact: less than 60% of detransitioners report needing psychological support. Some feel isolation, not fully accepted by either community, regret, confusion, or relief, depending on the case.
Work.
And that is most of the statistics that I found. There may be some more out there. I did try and cover the board across the world.
Yeah.
If that was the UK, America, Spain, the most common places. But I'll let JC take over this one because it's exactly what you love. It's all about medical aspects and the reversibility.
Yay!
There's quite a bit in here.
Okay, stunning.
Oh God, there's a lot here. Just do until you feel like.
I will.
There's a lot. I went ham in this one.
Okay. So, this is all about HRT.
Yeah, basically,
You know.
and the reversals.
So, the effects of a trans feminine hormone HRT is breast development, which is often permanent.
Yeah.
Reduced body hair, which is partially reversible.
Which is fabulous.
And fat redistribution, which is partially reversible as well. If that's stopped, some changes do reverse, like your libido, fat distribution, but others don't fully reverse, like I've just said, like breast growth.
Breasts. If you want to have them taken off, you would need to go and get a breast reduction.
Yes, ma'am. Or a double mastectomy.
Yeah.
Yeah. Now, if you are under the transmasculine experience, the effects of taking testosterone would be your voice deepening, which is a permanent thing.
It strains the cords.
Facial/body hair growth is mostly permanent. Well, it is basically permanent unless you get like laser
or
electrolysis. And your menstruation stops, which is reversible if you do stop your hormones.
Yeah.
If you do stop testosterone intake, periods often return, fat redistribution reverses, and your voice changes do remain then. Now, in terms of puberty blockers, specifically for the youth, it is generally considered fully reversible if stopped early. I think people fail to recognise that puberty blockers is used as more of a pause
than
it's
used.
A permanent intervention.
Even in puberty blockers, especially in trans women. So obviously they'll give you a testosterone blocker. Believe it or not, that is also used with people who are having testicular cancer.
Yeah.
They inject it into the man to stop producing sperm because it's the testosterone that's mutating down there, causing the cancer.
Yes,
so they will
ma'am.
give that to stop them producing it, to stop the cancer spreading. So one thing, the amount of trans people that come for trans healthcare is used across the board for everyone. Obviously, testosterone blockers, I've just said about testicular cancer.
It's gender affirming care.
It is. Hormone replacement therapy. Women go through that because obviously menopause or their hormone levels are lower. They're going through
where they
HIV.
Take their ovies as well.
Yeah, that's menopause.
No, wait.
Well, that puts them through menopause. That's why they take it. Because they're no longer...
yeah.
Because you've got to remember, ovaries and testicles are the same thing. Because when you are first created in the womb, you are a woman. And they were inside you. And then the phrase, the balls dropped.
Yeah.
Your ovaries dropped into your ball sack.
And created testes.
It is the same stuff. The same parts. So all the healthcare that we are accessing is used for a multitude of reasons, not just trans people. It wasn't ever even created just for trans people.
It was created for people.
It was for everyone, but it was never created just for us.
Yeah.
We've just been able to take it for the reasons we need it.
Completely. And now in terms of surgeries, you know, obviously I think this is kind of common sense.
Yeah.
Certain surgeries are reversible, some aren't.
Yeah.
You know, like chest surgery, it's usually not reversible, though you might be able to get a reconstruction.
Yeah, you might, I think.
You might be able to get implants.
Yeah, I think you'd have to like put on some weight, because the thing is with people that get their boobs removed, you've got to remember your boobs come off your weight.
Yeah.
So I know girls who've had breast reductions and then 2 years later they've put weight on and the boobs have grew back.
Yeah.
So I think you'd have to put a bit of weight on for it to like distribute there and then get implants.
You know, and then obviously genital surgery. So that's the vaginoplasty and the peniloplasty,
Which is
I think.
sadly permanent.
Yeah, it's irreversible in most cases. Although surgical revisions exist, but the outcomes vary. And it will never be the same.
Yeah, it'll never be the same to what it once had. Obviously, if you're having a vagina created, I don't think you realise a lot of it gets disregarded.
Mm-hmm.
You know, they only use certain parts of it.
Yeah, they use what they need.
Yeah, and then everything else goes to get incinerated.
Yeah.
Obviously, if you're having a penile
Plasty,
whatever they want to call it. I don't know how that works. I know they take a big skin graft out your arm or your leg, but I don't really know how that works. But I think that one may be a little bit more easier to reverse.
Yeah.
Because there's not as many blood vessels going to it, because you can't get erect naturally. You've got to pump it up. You gotta pump it up.
You gotta pump it up. Don't you know? Pump it up.
Up.
I hate this. I can't spend eternity here. Okay, so now let's talk about medical detransition care.
Yeah.
So,
Sorry, detransitions mid-conversation.
Currently, there are no universal guidelines for detransition care. Needs may include hormone reversal or adjustment, surgical revision if desired, and psychological support, which I think is needed. Analysis. I think psychological support is needed across the board, though, regardless of whether you transition, detransition. Yeah. But the big picture, in putting it all together, like I've said, detransition exists, but it is uncommon.
Yeah.
Most cases are temporary and influenced by external pressures. Regret rates are consistently very low, you know, less than 1% in many studies. Medical effects vary. Some are reversible, others, like voice surgery, are not.
Because you're fucking with your voice. And I'm sorry, no one forced you to do that.
Yes,
you did that on your own accord.
Now, the differences between youth and adult detransition. So let's talk about the differences. Most young people who explore gender identity do not undergo irreversible medical treatment.
Unless they have money.
Unless they have the resources to do so.
And then if they had the resources, maybe you shouldn't have.
Early stages usually involve a social transition, which is changing your name, your pronouns, your clothing.
But even
how
to
you
change your name, don't
society.
you have to be publicly out living the gender?
Like 2 years, I think.
2 years, isn't it?
And sometimes, you know, it's a case-by-case basis. Sometimes puberty blockers, which, you know, are reversible.
Which we love.
Detransition patterns, more likely to pause or reverse social transition and to reevaluate identity during development. That's usually the common ground where people do detransition,
but we've also got to remember the statistic of most of the detransitioners, like they do put it as one statistic, but most of them it's a temporary pause, because if it's medical, you know, if you do have cancer, you've got to stop taking hormones. You've got to treat that. If it's, you know, fertility, you've got to stop to be fertile again. And there's so many things that you've got to pause for. Not all detransitioners are detransitioning because it's a mistake.
Yeah, sometimes it's a necessity that they have to, unfortunately.
Sadly, like I know some people that have had to due to medical stuff, and they're sitting in a bed with like a full being, like, the fuck's going on? Do you know what I mean?
It's quite jarring.
It's
not wanting to, but
being forced to in a way to do it, and not because you you just have to.
Of course.
It's sad. It's I'd rather kill me. Kill me. If
Kill me.
that happens, put me in the grave.
Electric chair.
Put me in the grave alive.
Yeah.
I'll happily suffocate.
Suffocation.
Just leave a few Emerald Conti patches in there for me.
Yeah.
But that patch time.
Progesterone.
Progesterone.
You own everything. So basically, why does detransition happen in youth? I think it's a mix of identities are still being formed. Although I wouldn't have done it even though when I was a youth. But
no, same.
Family or school pressure and mental health complexity, which is studied in developmental psychology. But I think a good key point is for youth, detransition often means change in direction during exploration.
Yeah.
It's not reversing major medical interventions.
But that's where I've always stood my ground on trans youth.
Yeah.
I get it. Do you know what I mean?
Trans youth are children and adolescents.
Yeah, anyone under the age of 16.
Yeah.
I have always stood in a way and was like, no.
Yeah.
Like, unless they've done all that therapy, like, do all the work, but when you turn 16, you are on your own accord to do so. You mean you can get married at 16 if you wanted to.
Yeah.
You can do the medical transition and then. Because even at 16, you're not going through that much puberty.
Yeah.
Do you know what I mean? You're not going through the major changes. Yes, you're going to go pubic hair.
But that's on a person-by-person basis.
On a person-by-person, yeah.
I've heard some stories where children go through puberty at, the age of 8.
But sadly,
it's rare.
Yeah, it's rare, but sadly, that's the way it is.
Yeah. I went through puberty at 12, girl.
I was a bit older. I was about 13.
It was actually traumatic.
Yeah, I was quite old for puberty to hit me.
Yeah.
And most of the changes didn't really hit me until I turned 18.
Yeah.
I didn't really have an Adam's apple at 16, 17. I think once I turned 18, 19, it really started protruding. And I was
Eve
like,
kicked that throat in.
What?
Eve kicked the throat in.
Literally.
She was like, Adam's apple.
Boom!
Yeah.
Kicked it out. And
This
just
hit my
bing.
brow bone. God just gave me a welly to the face and just went...
Yeah, it's just,
Brow bone
it's
popped
swelling.
out. Yeah.
It's forehead swelling.
I promise. I had my hair dyed last week. I'm having a reaction.
I'm allergic to bleach.
Yeah. So do you want to talk about adult
Yeah,
detransition,
happily.
which is what Elle will be doing?
So what's different?
Didn't even hear me.
What's
Balls.
different? Right, so what's different? More likely to have is hormone therapy, surgeries, detransition patterns is less common overall. More likely to involve medical changes and stopping hormones, which we've already spoke. Why adult detransition? Extend.
No. Sorry.
No. External pressures, workplace, relationships, health concerns, identity change, less common but does occur. And the key point to take from this is adult detransitions tends to be more medically significant, but is rarer and often still temporary.
Yes,
Direct comparison between factors, youth and adults. So common stage for your factors is social transitioning and medical transitioning in adults.
Yeah.
Reversibility is high within youth and mixed within adults.
Yeah.
Main driver in youth is identity development, and within adults is external pressures.
Okay.
Permanence within the youth is usually low, and in adults sometimes higher. So at the end of the day, it does stand by my point in a way of, yes, there's a select few.
Stand by your tranny. Give her 2 arms to cling to.
It does stand with my point of letting kids be kids in a way.
Yeah.
Yes, they may come to you and go,
I think that's getting harder now, though.
It is getting
social media pressure.
It is getting harder, but it shows within the youth, it is very high that most of them reverse, and it is very low that it stays as a permanent thing that they are trans. So maybe we just have to listen to them and heighten the process to allow these kids on it. I'm not saying all children. There's children out there that truly are, but there's clearly more of these children that feel this way.
Yeah.
They just needed a little bit more time to figure it out before you started shooting them up with some form of medical things.
Yeah, completely.
So maybe we need to heighten the procedure and the way we go about giving it to the youth.
As a child, your mind's up in arms anyway.
Yeah.
You know, you quite possibly starting puberty or currently going through puberty. You know, you've got external pressures like school, family, etc.
Yeah.
You know, and it's a lot to navigate as a young person.
It is.
You know, your identity. So I understand why certain, younger people do feel the need to express themselves in that way. You know, and I guess my take on that would be explore gender identity. It's always a good thing, put a little bit of makeup on, but a bit of a lip, a bit of a pop, but let it sit. Actually think. Don't get me wrong, I was the poster child for jumping straight into things.
Oh no, same. Do you mean tell me not to do something and I'd do it 1,000 times worse
quite
than what
literally.
I was ever thinking.
So I know it's easier. It's easy said than done, but if you are a younger person listening to this, just let it marinate.
Yeah, literally make it like good chicken.
Yeah.
Give it time in the fridge.
Yeah, in the slow cooker.
Yeah, suffocate yourself with a little bit of cling film for a little bit.
Yeah.
And marinate on it.
Struggle
And hard work and a bit of elbow grease makes it worth so much more. Or steal it. It always tastes better when someone else's.
Oh my God. We do not recommend or condone stealing.
Maybe. Is it stealing? If they make so much money anyway.
Babe.
Like, I'm sorry, if I walked into Chanel and could steal a bag and walk out with it, I'm doing it.
Lawsuit pending.
I've never done
Where did you get that Louis Vuitton? Is it a Laddie Vuitton? I think it's a Laddie Vuitton.
You're looking over there like I've got one. That bag's from Primani and it's over there. Look over there.
She's behind you.
The common narrative of obviously young people are rushing it into irreversible treatments. What data shows is medical pathways are typically gradual and cautious. Youth treatment usually starts with social transition and then following into puberty blockers, which we have spoken about being reversible. Mm-hmm. Standards are guided by organisations like the World Professional Association for Transgender Health and the Endocrine Society.
Endocrine.
Yeah, endocrine. And the reality is irreversible interventions for minors are less common and more regulated than often portrayed.
Yeah.
And then the other common narrative is detransition proves transition is harmful. What the data shows on this is detransition is a small minority outcome. Many detransition due to social stigma, safety concerns, blah, blah, blah. Reality, detransition highlights the need for better support systems, not necessarily that the transition itself is ineffective. And then we also have, which is the last one I'll go through and I'll pass you back to JC, is obviously detransitioners are ignored. What the data shows here is historically under-researched, but growing in attention, increasing recognition of need for tailored healthcare and psychological support. Reality, both can be true. They need to be more support.
She's starting a detransition right in front of us.
Oh my God! And their experiences are sometimes over-amplified and is misleading in ways. Right. So it is like the healthcare needs to be changed a little bit.
Yeah.
It's not a new thing, but it's been not very changed. It hasn't really changed
since
really.
It's been induction. Stagnant for a long time now, And
I do think it is
change is always good.
But it is always good, but you've got to be very on the ball. So I think they need to fully sit there, speak to all people across the board and see what would work a little bit better.
But they don't want to do that because that costs money, time and energy.
Yeah, it does. Yeah, Angel. But at the end of the day, it's something that clearly needs to be done.
Yeah.
Because if people are detransitioning at the rates that they are, obviously it is less than 5% of the 2 or 1% of the population. So it is a minuscule amount of people compared to what the statistic shows. I know people hear 5%, like,
Oh my God, it's
But
everyone.
5% of a 2% population
quite
of the globe. Do you know what I
Yeah.
mean? It is tiny. It's literally a grain of sand.
5% of 2% is like 0.0000001.5%.
Literally,
You know,
it is
it's minuscule.
You wouldn't even see it under a microscope of a fucking 1,000 times.
Quite literally.
Like,
I think a
big.
good thing to think of is think of transition as a multi-stage pathway.
Yeah.
It's not a single decision.
No, there's
Like the steps.
It's like water.
It's like what? The
we have
Lord,
rivers
the Lord.
and lakes and reservoirs.
No, but how fucking bang on is that though?
Literally, like if I had stumped my toe, my
Think of
little
it like
toe,
water.
it's just like water.
Yeah.
I say it all the time.
Do ya?
Yeah, I'm like, it's just like water.
Oh my God, that's my legacy. Water.
It's just like water.
I think to end this topic, I think we should just go step by step.
No.
On step by step, day by
day. I love that song. Isn't that a Whitney Houston song?
I think so, yeah.
It is. I'm sure. Yeah.
The podcast episode, step by step,
brick by brick. It is. Brick by brick by brick.
Oh, brick. I'm looking at one. Okay, so transition pathways and where detransition can occur. Like I said, think of transition as a multi-stage pathway, not a single decision. Yeah. So, identity exploration, that is always number one.
Yeah.
It always, basically, it's a case of fuck around to find out.
Literally.
Not in a mean way.
But you've got to dip your toe in the water.
Yeah, to see if you like that temperature.
Yeah. If it's too cold, put a bit more in.
Have your fingers in different parts. So, identity exploration, the internal understanding of gender. No external changes are required. It's more of a mental thing.
Yeah.
So, detransition here. So, reinterpretate an identity. It's very common, especially in youth. Next step would be social transition, which would be your names, pronouns, clothing, presentation. It's fully reversible.
Can I just say as well, Joe, the way it keeps highlighting youth, maybe we just eradicate the youth.
Oh my God.
Are they needed?
Well, yeah, the next generation, babe.
Would you want them as the next generation that are a bit thick?
But weren't we when we were younger?
No.
I was.
I knew how to do things. I knew how to play in the street. I knew what a game of rounders was.
But you couldn't put a fucking eyelash on, though. So if you wanted to detransition at that stage, it would just be returning to previous identity, so your previous identity socially.
Switching back to that birth certificate.
Yeah.
Would you have to pay for that, though? Because I know you've got to pay to have your name changed.
Possibly.
Because I did mine through Depol. I was able to
Same.
change my title and my name.
Yeah, same.
Really easily. It's a bit scary.
I know.
It's a bit scary. Because I didn't even ask, have you waited 2 years? There was no proof. I was just like, yeah, I did. By the way, I did wait 2 years. I waited, I think it was nearly 3. My mum did it for my birthday.
15, 16, 17, 18, 19, 20. 6 years I waited.
Do you know what I mean? But it never asked, like, proof. I was able to change my title, my name, and everything.
Not like a doctor's letter and nothing.
No, and you meant to.
Yeah, it's a bit shocking, actually. Okay, well.
So you could name
Government.
Government. You could name yourself dog, cat.
Oh my God, yeah. Mutt for L.
Mutton dressed as lamb for JC.
Oh.
Oh. Girl, I did your makeup yesterday. I know how much leather that skin feels like.
How much leather that skin feels like.
In those words, exactly. Honey, it's past an hour.
I know.
To have got that much out of it.
Okay, so step 3 would be medical, which can be non-permanent. So puberty blockers, which just pause puberty. It is largely reversible, yes. But if you wanted to detransition there, that would mean stop your blockers.
Yeah.
Your puberty resumes. Step 4 would be hormone therapy, which Elle has yet to do. So that, you know, is...
If you have an overdose on fucking Adderall, Conti, you little bitch.
Oh my God, at least I'll die Conti. At least I'll die Conti.
Conti. Death by Conti.
Conti.
Conti death. I don't want contraception. I don't want no conch. I want
Conti.
Contiception.
So hormone therapy is estrogen or testosterone, which is partially reversible. Some effects are reversed, you know.
And others are not.
Others aren't, you know, like your voice, breast growth,
growth,
etc.
yeah.
If you wanted to detransition there, you would stop hormones and possible partial physical reverse.
Yeah. Would you not have to go back onto the hormone you are assigned at birth just to boost it up maybe? I'm not 100% sure.
I don't know.
I think if the longer that you're on them, you may need it.
Yeah.
But the problem is, obviously, especially with trans females that have had the bottom surgery, like, it is so
you need
dangerous.
it, otherwise dust to dust, ashes to ashes.
Literally, your bones turn to dust. You will become the Crypt Keeper real quick.
Yeah.
Within about 5 years, your bones will just disintegrate.
Step 5 would be surgery. So chest or genital procedures, which are mostly irreversible.
Yeah.
If you just want to detransition there, you could possibly get surgical revision, which is extremely limited, and also psychological adjustment.
And I think you'd have to pay for that.
Yeah, of course you would.
I don't think the NHS would give it. They just about give you bottom surgery, girl. I highly doubt they're going to be like, yeah, I know we've just give you a £50,000 bottom surgery, but we're going to give you now at a lovely, gorgeous £100,000 fucking...
Fat chance.
Literally not happening. Not happening. You're going to have to graft out your asshole at least 100k.
Quite literally.
Like lich.
I would just get like those prosthetic plastic things from eBay.
Do you know what I would just get? A fucking strap-on dildo and suck it into your fucking vulva and just walk around and go, eh!
Oogly boogly bitch.
Boogly boogly. Yeah, helicopter.
So, the common narrative is detransitioners are ignored.
Yeah.
What the data shows is that historically under research but growing attention, it's increasing recognition of need for tailored healthcare and psychological support, which is needed across the board.
It is across the board. Male, female, no matter if you're black, white, beige, you're Lebanese, you're Lebanese, you're Orient.
So the reality, both can be true.
Yeah.
They do need more export.
They do need export is ABC drive.
They do need more support, and their experiences are sometimes over amplified in misleading ways.
Yeah, of course.
And what do you call it? I think a lot goes to show about that, the thing that was on this morning.
Yeah.
You know, yes, unfortunately, that lady who did transition to male at a young age, and you know, was on puberty blockers, then later regretted it. But once 20 years old, they got top surgery.
Yeah.
So that was kind of on
and
them.
that was on their own accord. I mean,
Yeah.
their brain had near enough fully developed at that point. Their frontal lobe was ready.
Yeah.
They still decided to take that chance.
Yeah.
Honey, if you had even a little tiny bit of inkling, you just wouldn't do it, would you?
I think to summarise everything we've spoke about in this conversation today, that not everything has to be for definite, if that makes sense.
Definitely not.
Just explore before you go down the permanent route.
Yeah, take the time. And
I'm not being funny. Take from me an L. You know, I guess we could have easily have got surgeries if we
if you want something, you will work for it.
Yeah,
Do you know what I mean?
and don't get me wrong, we both want them eventually, but
I just want to enjoy my time a little bit. Do you know what I mean? I just want to let the hormones.
Girls just want to have fun.
Just on a final perspective, the UK is currently moving towards a model that is more cautiously medically and more focused on mental health and assessment and more data driven within theory.
We needed this 10 years ago.
Exactly. But, and it's a big but, is the science is still evolving. Ethical disagreements remain unresolved, and the issue is heavily shaped by politics and media framing. So, you know, obviously we've went into a great detail of things here today.
And we rambled.
Pardon?
And we rambled.
And we have rambled.
I love a good ramble, though.
I love a good ramble. I think that's what we're so good at.
Yeah. Gift to the gab.
Gift to the gab. The gibby gabs.
Yeah.
I think your name would have been Gab.
If I was bio-female?
No. Off topic, but I sat there the other week and I was like, if I was to change my name, what would I have picked? And the name popped into my head. I went, oh, why did I not think of that 2 years ago? Madison Woodfield.
That would be... Yeah,
wouldn't that have been
so
Jack
cunty.
Cunty?
Yeah.
Yeah.
Do you reckon... What do you think I would be if I wasn't JC? Because I went Tiffany. At first, my mum was like, no, that's a prostitute's name. I was like, oh.
Pretty Tiffany.
Nice one, mother. Rest in peace, girl.
To be fair, I think I've always seen you as a JC.
JC.
Maybe.
Like Like, I'm not being funny, as if being trans isn't enough, I have to choose like a really unique name as
Do you know
well.
how hard it is to name yourself though, guys? Like,
oh yeah, just don't be one of those where it's like Dior, Fendi,
Dior, Chanel, Prada, Balenciaga,
Tilapia.
Tiffany.
It's like
The Third, Pussycat Boots, Pink.
the whole stamp. Yeah.
Girls Aloud.
Pussycat
RuPaul
dolls.
Charles, The Fifth.
Pork chop.
Primark, River Islands, H&M.
I don't see any fucking H&M on this walkway.
Okay, sorry, I'll take off H&M.
Thank you.
Versace, Messino, Barbie, Bratz doll, Pussy Pink.
Los Angeles 91.
Yeah. Like, fuck off.
Yeah.
You might as well go, my name is serial number 0009249, cunt.
My name is Barcode.
Barcode. Beep, 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 beep.
Quite lich.
Oh, okay. Oh, that tastes funky.
That's what Boo says as well.
No.
How do you feel when you look outside alone?
When it's cold out here.
Okay.
Or maybe you should know how it really feels.
Okay, so
Dear little tranny.
I've got to take Elle back to the home now.
Yeah, my day release is over.
I do just want to say at the end of this, in term, I wouldn't have been able to transition properly without my mum.
Yeah.
As well as my auntie, a lot of women in my
Without
life.
your
But
support system.
my mum was always the gateway and the guide.
She allowed, not allowed, but she let you
Flourish.
experiment and flourish without judgment or critique.
And after everything we spoke about today, I know that feelings can be hearty and heavy.
Yeah.
Once again, we'll put in the description, the website of the Samaritans, and you can get their contact details. But yeah, you're never alone.
No.
And even if you do feel that transitioning isn't worth it, although we don't agree,
just be careful what you say.
Yeah, just be careful. And at the end of the day, there's always someone there to speak to.
Exactly. There's always someone. And I just like to thank you, JC, for coming on today. I know you weren't feeling very up to it today. And you have pulled through. And
I feel a bit more cunty fresh now.
Yeah, I think...
A glass of wine is in order, though. I'm going to be getting one after this.
We really need to stop drinking wine after these episodes. To be fair, we've been good recently.
Yeah,
We've
I only had one.
Yeah. You had one yesterday.
Yeah, and I'll have one today.
Last week we only had one and then we went home. We were good.
Yeah, we have been.
We've been very good. See, Mom, I'm not an alcoholic.
Yes, but I can't afford to drink too much.
No.
Yeah.
It's not the end of the month yet. It's not payday.
No.
No,
mentally afford. I can't mentally afford it.
No, same. But thank you, everyone, to the viewers, and thank you, JC, for joining me.
You're welcome.
It's a privilege as always.
Vice versa.
Because I started recording this episode. JC was like, "No, actually, I feel so left out.
Yeah, I was like, I have things to say.
So I'm happy you did.
Thank you.
I'm happy you came and joined. It's been a lovely conversation as always.
It has actually.
And guys, keep tuned for next week's episode because I'll give you a little sneak peek.
Come on.
It is the first JC takeover.
Dun, dun, dun. Elle has been receiving threats as of lately.
Death threats.
Detransition
threats.
Detransition threats. So she's currently on full guard.
Yeah.
No, she's got security 24/7.
24/7. I've got to go into the country and live in the sticks for a week and a bit.
And we have to pray for Elle's safety.
Yeah.
I'm
not even here.
Yeah.
I'm not even here. I've been doing this over the phone, girl.
But there'll be more updates next episode in terms of Elle's safety. So keep your eyes peeled.
For all of that. And hopefully after that, we should be getting into some amazing content. I know we say this all the time. It's
but
coming
we promise.
soon. But we are taking... Because we've got, obviously, this coming out. We've also got this week that we're filming. We've got this week's episode already in the bag, ready to go from the week prior. We've got this one for the next week. And then the week after is when, obviously, I am in hiding. But that video will... this episode, isn't it? No, the next episode will come out. And then even when I'm in hiding, we are planning and scheduling
of course
all of our good juicy stuff, and we're working with our team about sets and getting everything set up for that.
Yes.
So stay very tuned for that, guys.
We apologise, but it will be worth it.
It will. It's a graft, and it is something that we have absolutely loved doing, but we are working very hard behind the scenes. I don't think a lot of people see it. We want to make it right. Yeah, we don't want to fuck it up in a way. Yeah. We want it to look good. We want it to sound good. We want it to just be good across the board.
Tens
and for our guests to feel comfortable.
Completely,
because obviously in the room that we use that you typically see, it's not a very large room.
No, and the table takes up most of it.
Yeah, the table literally takes up half the room.
So, on the episode where we do quite possibly have a special guest, you might see different surroundings.
You very much will.
I guess we'll see.
And you never know, we may love it that much and it may be our new one.
Exactly.
We are working with the team with that and trying to figure something out, which will be happening over the next few weeks.
Yes, ma'am.
So for you guys that have applied to be a guest on the show,
keep looking at your emails,
Keep looking at those emails. I know we've been saying it for a few weeks, but they are coming.
Yes. We promise.
So if you haven't filled out your bio, please do.
Yes, get it into us, girls. And if you do want to be a guest on the podcast,
please let us know. Reach out.
Shoot us an email. DM us on socials.
Which our email is thetearsmutualpodcast@gmail.com.
Our Instagram is the Tears Mutual Podcast.
And our Instagram is the Tears...
I've just said that.
Oh, yeah. Sorry. But yeah, get through to us in there. And,
yes, ma'am.
And even if you know us personally, reach out to us through our numbers or whatever you have, WhatsApp.
And we are currently working on a website as well.
Yeah.
We don't know when that'll be up. But it'll make it more convenient for people that
just so you can have
contact.
a nice link to everything. We are going to be working with our team here at Fact with that because we've
Thank you, Fact.
We're going to work with them and get all that sorted. But we have rambled. We've done our plugs.
We have shameless plugs.
Our shameless plug.
So yeah,
guys, it has been a privilege as always. And we shall see you in the next episode. And hopefully you'll get to see our gorgeous faces once again.
Yes, I'm sure you will.
Hopefully. Yes. Best odds. Otherwise, I will be suing.
Lawyer in process.
But until then,
bye.
Bye. Oh, the fuck is that?
Oh, I don't know. Gail, get the door.
I'll get it, yeah.
Who's that?
I don't know.
The kettle's on.
Gail, hurry up. We're on live.
Oh shit, sorry.
Come on. Oh, Gail, right. Come on. Let's do this.
Come on, right.